Hi folks, my name is Mike Hobbs. I'm managing editor for Reminder Publishing, and I'm the host of Government Matters here on Focus Springfield. Today I have the pleasure and privilege of speaking with State Senator Jim Welch. Jim, thanks for coming in.
Thanks for having me.
Okay, so Jim, you've already looked at my notes, so there's not going to be any gotcha moments, although I'll try later. I'll try later here. We've got this is the time of year where not only has the legislature started a new session, but now you guys are talking about budget issues. It's a time of year that's just chock full of stuff that you guys are doing. I know that committee assignments have been switched around. What is your committee assignment at this point?
So I've been appointed to be the Senate Chair of the Committee on Financial Services, which deals with both banking and insurance type issues. So obviously with a district that includes Mass Mutual and many other insurance and banking institutions, it's a committee that has oversight over the regulatory bodies, I guess, that deal with obviously banking and insurance. So it's part of my background. I was from financial services prior to getting into public service. So it's actually somewhere that I've wanted to be for quite a long time, and I'm very happy and very pleased that the Senate President chose me to head up this committee. It's obviously some very weighty and heavy issues that come through the committee, and I'm looking forward to the challenges. I'll miss the healthcare stuff, and I'll still be working on healthcare related policy issues, but the Financial Services Committee is a committee that, again, I've longed to chair for since I first came into the legislature.
I was wondering, what are there legislative agenda items for this committee that you're looking at now? I mean, I know you've just been named to it, but are there issues or concerns that you would like to address?
Well, absolutely. I mean, obviously, there's a lot of consumer protection issues when it comes to insurance products and banking issues. Obviously, that when it comes to oftentimes the products that people are purchasing are being sold to them, let's face it, are complicated products. And oftentimes consumers can be overwhelmed. So I think much of the work that we do and some of the legislation that we'll work on this upcoming legislative session will be around consumer protection, consumer advocacy type issues to make sure that the businesses that are selling these products to individuals and families are really providing them with the most basic information to help them make their best choices.
I know that in the past few years we've seen stories and situations about nationally based banks and various procedures that they have had with their customers that aren't very good. It seems to me that the banking industry, unfortunately, like so many other industries, has gone from being a locally based or even a statewide based kind of business to now one that stretches way across state borders and sometimes from one side of the country to the other side of the country.
Yeah, it's very interesting. There's very few locally owned banks anymore. You do have locally owned or established credit unions, credit unions and banks operate under slightly different rules. But the locally owned banks are unfortunately going by the wayside. Many large and nationwide banks are really trying to kind of brand themselves as a community-based bank, and for good reason. Obviously, the people that work in the local branches and are from the local community. But you're very correct in terms of locally owned banks. There's very few, through mergers and acquisitions over the years. Most locally owned and community-style banks have been either merged or acquired by other larger institutions.
As a guy who's got a background in this, does it concern you that we see this continuing trend of national or large regional banks buying out locally owned banks?
Well, it's certainly a trend that has been happening for I would say the last 10, 20, 2 decades, I would say. Does it concern me? I think as a person who really appreciates that kind of community-based style of banking or providing those services, it concerns me from that point. And from a standpoint of if you have your assets somewhere, you want to be able to have, accountability, local accountability. So that's very important. Many of the banks do have local boards that are, comprised of local people, and obviously, like we stated before, many of the banks obviously hire people in the community. But there is definitely a concern, or at least we have to keep our eye on the fact that as banks get bigger and more national, you lose that really, community type relationship,
Right.
one-on-one relationship with the consumer. And, part of it's because of technology, part of it's because just, to be a bank, to have a large institution, you have to have, many assets. It's more profitable the more assets you have, and a bank with a nationwide presence is able to maybe in some cases provide better rates, to their consumers. So there are benefits that go along with it, but I think that personal connection that some people are looking for isn't there as much as it used to be. Let's face it, people used to get their paycheck on Thursday or Friday and go in every week and cash their check, and that just doesn't happen, that often anymore. Many of the transactions that happen in banking are done over the internet, but at the same time, what's more important than the mortgage on your house, and having that relationship with the institution that that's local, and be able to pick up the phone and know who you're calling if you have a question. For most people, buying a house is the most important or the biggest financial decision that they make in their entire lives. So I think when it comes to that, you see a lot of people that do move towards credit unions because you have that a little bit more of a community-based style to it, but at the same time, the larger institutions, because of the assets that they have and the presence that they have nationwide, are able to provide maybe a little bit of a better rate.
Right. Let's talk a little bit about two things that generally are issues that come up every year in the legislature. I want to talk about educational funding, the foundation budget. I know that the last legislative session, there wasn't an agreement on this. Do you anticipate that the Senate and the House can come together with something to present to Charlie Baker?
I do. I believe, the governor has filed some proposals as well, and, I think both the House and the Senate are committed to coming to a resolution. I think last session, unfortunately, that the time to come up with a final deal, unfortunately, was pressed into the last 2 weeks of session. And I think when you're dealing with an important issue like education funding that obviously affects all 351 communities across the state, and we're talking about a lot of money and money that needs to be spent obviously wisely, the issue is, I think, right on the top of everyone's list this year, to try and, in the Senate, we took the recommendation of the Foundation Budget Review Commission, and that's what we tried to live up to with our legislation. The House took a slightly different path for many reasons. Part of the reason was when we developed and approved our legislation and the funding for it, there were still some funding opportunities that were available. For example, the millionaire's tax or the fair share amendment was still in the mix, and we were expecting it to go on the ballot, and most people predicted that it would have passed. And if it did pass, that would have been a $2 billion influx of revenue to the state. By the time the House brought up the issue and was debating the issue, the courts had struck down the fair share amendment and the millionaire's tax and decided that it was unconstitutional. So they didn't have that source of revenue to be able to count on. So that's why I think you saw the difference. One of the main reasons why you saw the differences between the House and the Senate, and one of the main reasons I think that negotiations were to broke down. But I think coming up in the beginning of this legislative session, I think it'll be one of the first things that we try and accomplish, either during the budget, soon after, or even maybe sooner, right before.
The other thing, and you touched on it briefly when we're talking about your new assignment, is of course health issues, health insurance issues here in the Commonwealth. Where do we stand now? Because I know that our budget has a huge chunk taken out by health insurance and health concerns. Certainly we haven't had any forward movement on a national level in terms of either strengthening a national health policy. They've tried to gut the Affordable Care Act, but it's still there and people are still using it. So what's our status in Massachusetts right now?
Well, Massachusetts, we're always at the cutting edge, and I've been fortunate to be able to chair the Healthcare Financing Committee over the past 3 sessions in the Senate, which has been like, acquiring a PhD in health policy, I always say. Healthcare is a very vast world, very competitive world, a lot of money, as you stated, about just north of 40% of the state budget every year is tied up or at least spoken for by mass health and other healthcare related issues. So it's a very costly expenditure, not only to the state, but it's a costly expenditure to businesses, and most, as we all know, it's a costly expenditure to individuals and families, because it's, you obviously have to have health care here in Massachusetts, or health care coverage, and to be able to have that, all 3 of those entities participate in helping a person or a family get covered, meaning the business, the government, and the individual through the individual mandate. So in Massachusetts, we're typically always on the leading edge of taking bold steps to move forward. So last session, as I chaired the Senate Committee working group on healthcare cost containment, we developed and passed legislation in the Senate that was focused on making some changes to the market to help reduce costs over the long term. Because if we don't do things to address the market and address the costs of healthcare over time, and do things to make sure that our policies on the state level are enabling us to be able to take advantage of technology and be able to take advantage of all the new things that are out there in the world that can help us reduce costs. So in the Senate, we were able to pass it. The House passed a different version of their healthcare cost containment, and we were chaired the Senate side of the conference committee, but again, it was a piece of legislation that we had passed in the Senate in November of 2017, and unfortunately the House didn't get to it for many different reasons until June of the last month of our legislative session. So we tried to negotiate a compromise, but weren't able to do that because we just didn't have enough time to be able to do it. It's such a very weighty and a lengthy policy area that you really need a lot of time, especially with 2 differing philosophies about how to address it. You really need to have that time to be able to negotiate, and we just didn't have the time.
Do you think that we talk about costs of healthcare? The usual journalistic cliche is you follow it with the phrase spiraling out of control. How is that accurate to say that we have to face increasing costs at a time where perhaps we're concerned about revenues and whether or not those revenues can meet the increasing costs?
Well, I think it provides opportunity, because I think in many cases with healthcare, especially in Massachusetts, because we're a healthcare state, we're an education state, a healthcare state, a technology state, and like I said, we like to be the leader. So many of nationwide leader. I mean, the Affordable Care Act was based on Massachusetts healthcare reform from 2005. So bringing healthcare to the forefront and making sure that we're talking about it, and talking about it in a serious way, is really a big component of it. Getting people into the mentality, or into the right frame of mind to be thinking about, okay, we need to address these issues, is really almost half of the battle, because it takes time to develop these policies, it takes time to do the research, it takes time to have the negotiations. But the governor, the speaker, and the Senate president have all indicated that they would like to continue to work on cost containment here in Massachusetts, because if we don't, I wouldn't say spiraling out of control is the term that you used, but I would say unsustainable. The costs just continue to go up and go up and go up, and if we don't make changes, especially in my opinion, systematic market changes that are more consumer based, more, have the patient in mind rather than the insurance company or the provider in mind. Really have the patient in mind. I think we need to make some changes on the state level that over the long term will help us save a lot of money. Until we make those systematic market changes, everything else, I think, in my opinion, would be more of like a Band-Aid.
Is it difficult to try to do that on the state level when there's a national consideration when it comes to health policy and health costs and prescription costs? I mean, is there just so much we can do as a state, knowing that there's other issues that really need to be addressed at the federal level?
Sure. Yeah. I mean, for a couple different reasons. First of all, Medicaid, which is a state contract agreement basically between the federal government and the state government to cover lesser income individuals in many cases. So that money comes from the federal government. So if you're going to make changes to your Medicaid program, you actually have to apply for a waiver. You have to apply for permission, basically, to the federal government, have whatever changes you're going to make approved by CMS or the federal government. So for that reason, alone, gaining the permission makes it challenging. And then the second reason as well is if Massachusetts, for example, doesn't line up with the same philosophy on the federal government, and let's face it, with federal government, the current Trump administration, the way they look at funding Medicaid, Massachusetts is receives a very healthy portion from the federal government to cover its Medicaid population, its Medicaid program. But the Trump administration has talked about, changing the way that those funds come to each state. And that would have a drastic impact, negative impact on Massachusetts, because we rely on that federal funding to be able to cover many of our citizens here in Massachusetts. So for those two reasons, one, you have to get permission by the federal government to be able to make the changes that you really need to make to have a big difference. And two, if you're not lined up philosophically with them, the funding unfortunately could go away, and that would have a drastic effect on the amount of individuals you could cover and the type of benefits you're able to provide to them.
So I got this really nice press release from your office last night.
I have great communications director, Cam Stoker. He does a wonderful job.
Yes, this is very good. So you know what's in it, but I'm going to ask you questions about it anyway.
Sure.
And this is about the supplemental budget that the Senate passed. There was a couple things in it that really intrigued me. First was this, that the Senate proposal got rid of the caps on kids. And please correct my 15-second summation. This was basically a state law that said you can't have so many children and get all those children covered under welfare benefits. And the Senate decided to repeal that in their budget proposal.
In the House as well.
Do you think that Governor Baker is going to go along with that?
I hope so. I don't see why he wouldn't. I think, the original intent and why the cap on kids was put into place, I think we found out was more a result of anecdotal evidence than really any other evidence. The fact that we would tell a family or have a family, the original intention was to get at the fact that, or the idea that families were having multiple children or more children so they could get more benefits for welfare. And I think we found over time, obviously, that that's really more anecdotal and really just not true. So in the end, the cap on kids was really just affecting kids. So you'd have a family, if they had 4 or 5 children, or whatever the number was, that only a certain amount of those kids in that family would be eligible to receive benefits for that family. And I think it's proven over time that that's just not a viable way to address the situation. It was really, I think, a knee-jerk reaction when it was originally implemented. And again, it was based on anecdotal evidence rather than really hard proven evidence.
And it's interesting you say that. You know, when I did talk radio back in the 1980s, this was something I remember that was a staple. You know, it's like people who are on welfare are just having these kids, so they're getting additional benefits, and boy, are they making out.
And I think over time, we all realize that you know, just is not the case. I mean, it's,
Right.
you know,
So by eliminating this cap on kids, do you get a sense of how much budget money would be involved in covering the children who were supposedly not covered?
the actual amount that
yeah.
it'll require to, the number escapes me at this point in time, but I do know that it will have a substantial effect for many families and especially for many kids. But I don't know if the number is actually in the press release, but it's the actual total amount kind of escapes me at the moment. But
just explain for a moment the purpose of a supplemental budget, because I think that probably people think, well, you guys have gone through this process with the governor, you've hammered out a budget, but now you need a supplemental. So how does that work out?
Well, so every year in Massachusetts, we debate and pass a state budget, and it's typically these days around $40 to $41 billion that goes to fund all different state programs, state agencies. Anything you can think of that's state related is basically covered in the budget. And we try and estimate as best we can. We can only pass a balanced budget, meaning we can't pass a budget that goes beyond revenues that we collect. So a supplemental budget, oftentimes, as much as we try and plan out or try and budget out exactly what each agency is going to cost, or what each program is going to cost. In many cases, or not many cases, I would say actually a small number of cases, that agency required more money throughout the year. So the supplemental budget would be, excess money that we've collected, that we have available, that we're able to put into many of the agencies and the programs that we've already funded pretty fully through the regular state budget, but this would be additional money to cover excess costs that it required to run those programs.
Okay. The other thing that was in this press release that I thought was very interesting, and it speaks to the give and take between states and the federal government, is that you noted that Massachusetts received a 7.6% cut in its federal fuel assistance allocation, which had dropped from $200 million to $136 million in recent year. And the supplemental budget is trying to address some of that gap there. So here's another case where, which you just mentioned with Medicaid, the states look to the federal government to help people out with some fuel assistance. When that is cut, then it's up to the state to actually look at how can we try to close the gap and fill the need.
Exactly. So oftentimes when we budget out programs like that, sometimes the budgeting certainly is more on the conservative side, but falls a little bit short of what the program might require in any given year. And a lot of it depends on demand as well. If we were to have a warmer winter, some years we have warmer winter, not a lot of snow, not a lot of, and there's a less demand for fuel assistance. It doesn't require as big of a number to be able to provide those resources. But I would say we're a pretty average winter. This year it's been pretty cold, and unfortunately, anybody who's living in difficult economic circumstances, especially our elderly, that. You never want anybody choosing between, turning the thermostat up or eating or taking their, their prescriptions or whatever have you. So this funding really goes to, right to the heart of, I think, what government is there for, to make sure that, basic needs are being provided to some of our most vulnerable citizens.
And it also, like I said, it almost turns this into like this contest between the feds and the states. Yeah. And considering the winter we've had, we may have gotten off with a sort of average winter, but if you looked at other states, there's been a brutal winter for a lot of states, and you would think that the demand for heating assistance in those states is even higher than it would be here in Massachusetts.
Yeah, in the Midwest, and then you know, even now you're starting to see some states that, or some areas of the country that, you know, you probably wouldn't think would need you know, fuel or heating assistance, unfortunately are getting cold spells and that type of thing. So but I think it's much of it is a philosophical I guess approach on the federal level as to, you know, who should it be the federal government's responsibility? Should it be the state's responsibility? Should it be, you know, human service agencies' responsibility, or churches, or those type of things? Should it be that type of responsibility? And I think, you know, the current administration on the federal level, you know, I think just philosophically are really more committed to forcing states to really provide as much benefits as they possibly can, rather than having those states rely on money from the federal government, which, in my opinion, isn't necessarily the right way to go, because, again, in many cases, and this is a prime example, these are just providing basic needs to people, in many cases, our most vulnerable citizens. And it's not money that's wasted by any means. No one's applying for fuel assistance to be wasteful in spending. Right. They need, the reason they apply for fuel assistance is because they need it. Yeah. And I think anybody, you know, watching at home or anywhere else would never want their neighbor to go without proper heating or having the proper temperature in their home, especially if they're elderly or if they have young children, especially. So philosophically, I would disagree with how the federal government approaches it. I do think that they have the resources to be able to help us, right. Help the states, and you know, we just try and fill in the gaps when that money's not there, and this is an effort to do that.
I got to ask a quick question to sum up. I noticed that our neighbors to the south, Connecticut, the Governor Lamont, is proposing this massive toll network in order to gain revenue, including tolls on 91. Please tell me we would never think about putting tolls on 91 in Massachusetts to get revenue, please.
I don't think so. I mean, I know that there have been proposals, or I don't even know if they've ever reached the proposal stage, but more in the north areas of Massachusetts, like on the New Hampshire border, because you have a lot of commuters that come down from New Hampshire and work in the Boston area or the northern Mass area. There had been you know, I remember talk of putting a toll system in place to do that. But in my opinion, it's just like a dog trying to catch its own tail. It's, you know, it's just another way to increase revenue, and in reality, you end up affecting your own citizens. I know that the Connecticut proposal is really, I think, focused on trying to, you know, receive revenue from people out of state that are traveling on their roadways, and I understand, but at the same time, you know, especially in New England, you have so many people that are traveling within, you know, the 5 states or within the region, and you know, you can, obviously, being in Western Mass, we can be in Connecticut in 15 minutes. So, in my opinion, it just doesn't make a lot of sense. But I understand that Connecticut is really struggling when it comes to their budget, and really, right. really searching for ways to increase revenue and bring more money into the state. But I would recommend, because in the end, it's like, so. If they were to do that, then what do we do in Massachusetts? Put one up on the other side that just basically collects it the other way? And then, like I said, it's just like a dog trying to catch its own tail.
Well, that's some reassurance for me, and I appreciate that. And folks, you've been watching another edition of Government Matters here in Focus Springfield. Thank you for watching, and thank you to Senator Welch for coming by.
Thank you. Thanks, Mike.